Welcome to our video on upper limb fractures. This first slide provides a clear title of our topic. You can see an image depicting a fractured arm, which highlights the main focus of our discussion today, understanding the various types of fractures that can occur in the upper limbs. Let's move on to the next slide. Upper limb fractures often result from simple mishaps, like falling on an outstretched hand, sporting accidents, or can be due to weakened bones from osteoporosis. It's crucial to address these injuries carefully to ensure proper recovery and maintain full function of the arm. Now we're looking at a clavicle fracture, commonly known as the broken collarbone. This is a very frequent injury, often caused by falls on the shoulder or an outstretched arm. The X-ray image here clearly shows a break in the clavicle. Such fractures can sometimes lead to complications, like potential damage to the nerves or blood vessels nearby. Understanding the nature of clavicle fractures is important for recognizing the potential impact on arm function. Here, we have a proximal humerus fracture, which occurs near the shoulder joint in the upper arm bone. This type of fracture is quite common in elderly individuals, often happening after a fall, especially if they have osteoporosis. The image displays an X-ray showing a fracture in the proximal humerus. There are specific sites in this area where fractures can occur, and there are potential risks, such as nerve damage or blood supply issues to the bone. It's crucial to diagnose these fractures accurately to ensure the best possible treatment for the patient. This slide focuses on supracondylar humerus fractures, which are particularly common in children, usually resulting from a fall on an outstretched arm. The X-ray image shows a fracture near the elbow joint in a child's arm. These fractures are classified by their severity, and there's a risk of complications, such as damage to the brachial artery or median nerve, which can affect blood flow and nerve function in the arm. Proper diagnosis and careful management are essential for ensuring proper healing and preventing long-term issues. Now we're looking at a Monteggia fracture, which involves a fracture of the ulna, one of the bones in the forearm, along with the dislocation of the radial head, the top part of the other forearm bone. This injury often occurs from a fall on an outstretched hand with forced pronation, where the forearm is twisted. The X-ray shows both the ulnar fracture and the dislocated radial head. A potential complication is injury to the posterior interosseous nerve, which can affect hand movement. Recognizing the specific combination of injuries is crucial for effective treatment. This slide shows a Galeazzi fracture, which involves a fracture of the distal radius, one of the forearm bones near the wrist, and a dislocation of the distal radial ulnar joint, or DRUJ. This typically occurs from a fall on an outstretched hand. The image displays an X-ray showing the fracture in the radius and the dislocation at the wrist joint. This injury is sometimes referred to as the reverse of a Monteggia fracture because the locations of the fracture and dislocation are different. Proper diagnosis and treatment are essential to restore function to the wrist and forearm. This slide describes a Colles fracture, which is a fracture of the distal radius, the forearm bone near the wrist, with dorsal displacement, meaning the broken piece shifts backward. This is a common injury caused by falling on an outstretched hand with the wrist extended. The image shows an X-ray illustrating the fracture and the displaced bone segment, often creating a characteristic deformity known as a dinner fork deformity. Potential complications can include malunion, where the bone heals improperly, and carpal tunnel syndrome, due to pressure on nerves in the wrist. Correct diagnosis and management are important to ensure proper healing and restore wrist function. This slide details a Smith's fracture, which is essentially the reverse of a Colles fracture. It involves a fracture of the distal radius, the forearm bone near the wrist, but with volar displacement, meaning the broken piece shifts forward. This fracture typically occurs from a fall on a flexed wrist. The X-ray image provided shows the fracture in the radius, with the bone displaced towards the palm of the hand, often resulting in a deformity described as a garden spade deformity. Proper identification of a Smith's fracture is crucial for applying the appropriate treatment methods to ensure proper wrist healing and functionality. Here, we're looking at a scaphoid fracture, which involves one of the small bones in the wrist. This is the most common carpal bone fracture, often resulting from a fall on an outstretched hand with radial deviation, meaning the hand is bent towards the thumb side. The X-ray image shows a fracture in the scaphoid bone. These fractures are important to diagnose early because the scaphoid has a poor blood supply, increasing the risk of non-union, where the bone doesn't heal properly, or avascular necrosis, where the bone tissue dies due to lack of blood flow, especially in the proximal pole. Proper treatment is crucial to prevent these complications and ensure proper wrist function. This slide describes a Bennett's fracture, which is an intra-articular fracture at the base of the first metacarpal bone, affecting the thumb. This injury typically occurs from a punch injury or a fall onto the thumb. The image shows a hand with a splint, indicating the need for immobilization after such a fracture. Bennett's fractures are significant because they involve the joint surface and can lead to thumb instability or post-traumatic arthritis if not treated properly. Accurate diagnosis and appropriate treatment are essential for preserving thumb function and preventing long-term complications. This is a boxer's fracture, which is a fracture of the neck of the fifth metacarpal bone, the bone connected to the pinky finger. It typically occurs from a direct blow with a clenched fist, often seen in younger males. The image shows a hand in a cast, which is used to immobilize the fractured bone. Proper treatment is important to ensure proper healing and prevent deformities that could affect hand function, especially the ability to grip. So there you have it, a look at upper limb fractures. I hope this information has been helpful. Don't forget to like, share, and subscribe for more content.